Hi everyone, I am Vinodini. I share about brain computer interfaces for Parkinson's disease. First, I tell that the presentation is about how brain computer interface technology can be used to help people suffering from Parkinson's diseases. It also shows your introduction. Introduction. A brain-computer interface is system that allows direct communication between the brain and the external devices without using muscles or nerves. It collects brain signals and converts them into commands to control machines. Brain-computer interface are especially useful for people with neurological disorders where normal movement control is affected. Parkinson's disease is one such condition where BCIs can help patients regain some independence. Next, what is Parkinson's disease? Parkinson's disease is the medical background of progressive neurological disorder caused by the loss of dopamine producing neurons in the brain. Dopamine is important for smooth muscle movement. When dopamine level decrease, body movements become slow and uncoordinated. Over time, the disease worsens and affects daily activities and quality of life. Then, symptoms of Parkinson's disease. Major motor symptoms includes tremors, muscle stiffness, slowness of body movements. It is such as bradykinesia, difficulty in balance and posture. There are also non-motor symptoms or speech problem, reduced facial expression. These symptoms make normal life difficult for patients. Next, limitations of conventional treatments. Current treatments for Parkinson's disease have many drawbacks. Medications become less effective over time. Deep brain stimulation requires a surgery and is invasive. Treatments are expensive. Side effects are common. There is no real-time monitoring of symptoms. Because of these limitations, new technologies like a brain-computer interface are being explored. Then, overview of a brain-computer interface. Yeah, it collects the brain signals, analyzes them, converts them into commands, uses those commands to control external devices. Brain computer interfaces bypass damaged neural pathways and allow patients to interact with machines directly using brain activity. Then, brain computer interface system architecture. Main components are signal acquisition, collecting brain signals using sensors, then signal processing, removing noise from signals, then feature extraction, selecting important signals patterns. Other one is classification, interpreting signals. Then last one is output control, sending commands to device. This structured process allows brain activity to control assistive systems. Then types of brain computer interfaces used in Parkinson's diseases. It is classified into three types: non-invasive, semi-invasive, invasive. Non-invasive uses EEG signals, safer but less accurate. Semi-invasive, partially implanted. Invasive are implanted electrodes, highly accurate but risky. Each type has advantages and disadvantages depending on patient needs. Then brain signals used. Common signals are used to brain BCI, EEG, local field potentials. These signals show abnormal brain activity related to tremors and movement problems. By analyzing them, brain-computer interfaces can detect symptoms and help control devices. Then, role of brain-computer interfaces in Parkinson's disease. Brain computer interfaces can monitor brain activity continuously detect abnormal patterns, help control assistive devices, help doctors understand disease progression, improve improve treatment planning. So brain computer interfaces act as both monitoring and assisting tools. Then next, be brain computer interface based motor assistance. Here the focus is on physical assistance. Brain computer interfaces can be connected to robotic arms, exoskeletons, mobility aids. This system helps to patients walk better, maintain posture, improve hand movements. So overall, brain computer interfaces improve independence and quality of life. Then adaptive deep brain stimulation using BCI. Traditional database structure gives constant stimulation. With the brain computer interface, adaptive or closed loop DBS is possible. That means brain activity is monitored in real time. Stimulation is given only when needed. Side effects are reduced. Treatment becomes more efficient. This is a smart and personalized treatment approach. Next, advantages of brain computer interface for Parkinson's. Non-invasive options available, real-time monitoring, personalized treatment, reduced dependence on medications, better symptoms control. These advantages show why brain computer interfaces are promising for Parkinson's management. Then conclusion. Summarize the seminars. Brain computer interfaces are a powerful emerging technology that can be improved motor function, assist in daily activities, enable adaptive treatments, transform Parkinson's disease care. With further research and development, brain computer interfaces can greatly improve the lives for Parkinson's patients in the future. That's all about the brain computer interfaces for Parkinson's diseases. Thank you.